So for every employer in the state of Michigan, they're covered by the MIOSHA Act, which includes a requirement that all employers provide a workplace that's free from recognized hazards. Certainly COVID has been a recognized hazard in the workplace. So it's important for employers in non-healthcare settings, because we do have a specific healthcare setting rule in non-healthcare settings, to remember that they still need to be thinking about their workplaces and ensuring that they are providing that safe workplace. So some of the things that employers need to be thinking about as it relates to COVID in our communities right now is the vaccination rate. When we saw the CDC and MIOSHA follow suit in updating guidelines and guidance, it really focused in on those that are fully vaccinated. And in Michigan, about 90% of our working age population ranges from 20 to 65. And when we look just in that space, we're at about 49.3% that have been fully vaccinated. It's higher for the older age groups, it's lower for the younger. But if you look at any given workplace, if you fall just in the ranges of how the workplace is distributed by age, you're going to find that probably about half or more of your workplace is not yet vaccinated. So you're going to have COVID potentially in your workplace, potentially spreading. So you're going to want to be thinking about how you manage that. So some of the things that employers could or should be doing as it relates to keeping their workplace safe for non-healthcare settings is, these aren't requirements anymore, this is guidance, but always continue to have a plan. Plans are good. They help you ensure that employees understand the things that you're going to be expecting and the things that they're going to need to be doing. So that's always a good tool to have. If you can, or if you want to, you can continue those daily health screenings to try to keep COVID out of the workplace altogether. You're going to want to be thinking about how you space out people that might not be vaccinated. That 6 feet of social distance is still important, and maybe requiring face coverings for those that have not yet been vaccinated to help contain the spread of COVID. When we're both wearing those, if we're not vaccinated, we can cut the chance of transmission by as much as 70%. So it's a great tool to make sure that we contain COVID in our workplaces, and certainly continue that training on your plan and how employees should be behaving in the workplace. And then continue to encourage your employees to get vaccinated. That might just be providing information, could be going beyond that, maybe setting goals for your company, but vaccination really is the key to making sure our workplaces are safe. But if you put all of these things together, you'll be in a good position to make sure that you're providing that safe workplace and you're providing that workplace that employees want to be in.